Good morning. My name is Deirdre Hipwell. I cover healthcare for Bloomberg in Europe. We all know there is an increasing focus on the wider toll that the pandemic is taking on health systems worldwide and the knock-on impact that's having on missed cancer diagnoses and treatments. This is perhaps particularly the case in Africa, which is still grappling with the pandemic and a slower vaccination rate and health systems that are sometimes lacking in infrastructure. With me today to talk about these issues is Keller Rinaudo, founder and CEO of Zipline, which designs, makes and operates drones. He has a hugely impressive CV. He's been involved with a number of startups, and he's been doing a lot of work in Rwanda and Ghana in helping deliver blood to urgent medical situations and cancer treatments to patients in urgent need during the pandemic. Also with him is Dr. Joel Mubiligi, the Exec Director of Partners in Health, a non-profit global health organization. He started out as a physician in Rwanda. He spent time working for the Ministry of Health, and as an exec at Partners in Health, he's in charge of more than 200 people helping to integrate and improve patient care in Rwanda, a country devastated by genocide and a health system which for many years was struggling. Keller, I'd like to come to you. We're really interested to know a bit more about Zipline and what it's doing in Rwanda. And I've heard you talk about how it's not correct to call it just a drone company and it's an instant logistics provider. And I thought you could start us off by telling us what exactly Zipline does.
Yeah, I think that's probably the biggest misconception about what we do. Sometimes people look at Zipline and they see the drone and that's the exciting thing. It's the sexy thing. And so it's sort of what people focus on. But of course, the reality is that none of the partners that Zipline works with, whether it's Partners in Health or it's the government of Rwanda or the government of Ghana or health systems across the US, really want or care about drones. What they care about is being able to make sure that a medical product goes from point A to point B fast enough to save somebody's life. And our goal from day one when we founded the company was to build an instant logistics system for medicine to basically approximate teleportation in terms of enabling health systems to send exactly what's needed, where it's needed, when it's needed. We launched in Rwanda in 2016, and originally we're focused on delivering blood products. Today we deliver about 250 different medical products, essentially the entire public healthcare supply chain in this way, using instant autonomous electric vehicles that weigh about 50 pounds to deliver something to any hospital or primary care facility when something's needed. And over the last year, when the pandemic began to cause lockdowns across many countries, Rwanda included, we were able to partner with Partners in Health to begin sending cancer medications directly to patients, to primary care facilities right next to where they lived, to ensure that elderly or immunocompromised people who were depending on these treatments with their lives could still get access to them even when they weren't supposed to be traveling across the country.
That's really interesting. Joel, can you talk a bit more about how that's actually done in practical terms? I mean, patients have to know how to use the treatments. They maybe need some discussions. How has it actually worked? And, specifically for, cancer patients where often the treatment regimens can be, quite complex.
Yeah, so when we started this collaboration with Zipline, it was at the time of the first lockdown, total lockdown in the country in March last year. And at that time, we had already patient in care who was coming back to our clinic on a monthly basis to take their medicine and usually oral pills. So what we decided at that time, we had to divide our patients into different groups. The patients who needs to receive chemotherapy intravenous at the hospital setting was still needed to be at the health facility place and the clinic. So we had to organize logistic around with the Rwanda Biomedical Center and the district hospital close to them to drive them up to the place where they can receive that care. But we also had another group of patients who have been on their treatment for long, mainly patients with CML, chronic myeloid leukemia, who already knew how to take their medicine. So these were not patients who are new into the treatment, but a patient who have been receiving their treatment chronically. So that group really didn't need to come to the facility. And that was the group that we identified as a group that could use the service of Zipline to get the medicine, get closer to them. And we also had to work with the nearby community health workers, nearby health centers to make sure that the drug is delivered to the patient. So it was really an assessment of who can take that medicine and receive that and take that by their own. So usually patients who have already been in their treatment for a while. And also connecting with their nearby health system to support as well.
And how many people would you say were treated during the pandemic and received their treatments via drone delivery? And I know it was a response to the pandemic, but do you think this is something that you're going to scale out even further for cancer treatment going forward?
So that's something that we are exploring now for the same reason as I've outlined. If you consider patients who are taking chemotherapy, especially oral way, that does not need really specialized skills to give them intravenous treatment, there is really little reason for them to travel long distance, especially if they are stable. What we need is really having at least a system where they can go for usual checkup by a doctor on a monthly basis per se. But really getting their treatment, refilling their pills should be something that we can organize around and have a system to deliver to them. So the experience of Zipline or using a drone to have that closer to them and working with the nurses and the community health workers closer to them to make sure that the drug is delivered to them have been an experience that have been eye-opening to us. And we're looking into how do we do that, not only for that type of cancer, but even other non-communicable diseases. If you think about diabetic patients who need to take their insulin and so forth. So these are the things that we are really exploring. But the reality is it has to be built on already an existing infrastructure. You know, it will be difficult in a setting where the closest healthcare professional is, I don't know, 2-3 hours driving from the person. That will be very, very, very difficult because we also need a point of reference where it is delivered. And we also need to make sure that there is a community health workers who can identify the patient and follow them closely. For example, in Rwanda, the government system has close to 45,000 community health workers across the country, 500 health centers across the country. So all of those are already infrastructure that a technology, that a drone come and build up on it to really make it as easier as possible for the patients.
That's interesting. And Keller, what was the accuracy been like in this program? Because that's often a question people ask or think about when they're thinking about drone deliveries. And you must have hours of flying experience and data now. Can you tell us a bit about how accurate the program was, and I guess what your learnings were from that, and how that might translate into either further rollout in Rwanda or indeed in other countries?
Yeah, not hours. Actually, at this point, we have millions of hours of safe flight data. So orders of magnitude. But the funny thing is that when we are initially launching, so we initially launched by serving 21 hospitals. Today, Zipline serves about 2,500 hospitals and primary care facilities across Rwanda, Ghana, and the United States. And whenever we're adding a new hospital to the network, there's always this moment of like, I don't really think this is going to work. It seems like science fiction. And then 7 days later, we see doctors and nurses using it as though they've always had this. And they're like, yeah, of course we have drones that deliver these products, you idiot. Like, what other way would we deliver this? So it's really cool to see the way that something goes from kind of science fiction to normal in just a couple of days. Humans are very able to adapt to things. And I think one of the reasons it's been easy for people to adapt is that the system works more reliably than traditional logistics. We guaranteed a 97% service uptime when we launched the service. We ended up achieving a 99.5% service uptime, which is much better than any other logistics service out there. And so, at the end of the day, doctors and nurses, they care about reliability. They want predictability. They want it to be fast. It's pretty simple. Like, nobody cares how it's being delivered. No one no one cares how fancy the system is or what the technology is. Doctors and nurses just want to do their jobs and be able to save patients' lives. And I think this is an area where technology has advanced really quickly and where it's making it possible to just provide a different class of logistics that then unlocks this transformative potential for health systems that enable them to provide care in new ways, shift the paradigm, use decentralized care in virtual hospital and telepresence to reach people closer to where they live.
Mm-hmm. And in terms of Zipline, obviously you've had a recent funding round. Are you set up to roll this out further in Africa and in the US, which obviously a huge market potentially for Zipline? Do you feel that Zipline, you're ready to go? You've got the funding necessary to help roll this technology out?
Yeah, certainly. I mean, when we were seeing the data that was coming back from the work we've done with the Ministry of Health of Rwanda, with Partners in Health, with the government of Ghana, and new countries that Zipline's launching in. We launched in the US a year and a half ago. We started to realize, okay, this is generalized infrastructure, and not only can it save health systems money, but it can save lives. And so we do feel there's a moral imperative at this point to roll this out in many other countries and make it broadly available. The funding that we raised in December is really designed to make sure that Zipline is ready to make all of the investments necessary to bring this to from 25 million people that we serve today to 250 million people about 2 years from now.
And what is the biggest hurdle, do you think? It seems like you can get doctors and patients on board quite quickly. Is it the regulatory framework that's the biggest hurdle when you're thinking about expansion?
It's a very good question. To be honest, doctors and nurses have been many of our strongest champions. They're actually the people who get it the fastest. It's amazing, and I also have to say, I mean, Partners in Health has been such an incredible partner to Zipline over the last 2 years. And I was reflecting on that today, because a lot of folks in global public health have actually not been champions of Zipline. And I think the difference is that Partners in Health is this incredible organization that is on the ground doing the real work of administering a lot of these health systems, operating hospitals in complicated, hard places. So I would say, our strongest champions have been those partners who are on the ground doing the work with us. And then some of the people who have been expanding this infrastructure harder, I would say it's probably the folks in global public health who are not really in the countries that they're trying to serve and have less of a sense for what will work in these countries and what the countries need.
Sure. And Joel, Rwanda seems to be becoming quite a center of excellence for cancer care and treatment in Africa. What role is Partners in Health playing in that? And do you think, this is going to continue, which is a remarkable turnaround for a country which had such devastation only a few decades ago?
Mm-hmm. Yeah, obviously, this is going to continue. Just yesterday, we launched, the government, the Ministry of Health launched the National Strategic Plan for Non-Communicable Diseases, including cancer. And it's a very ambitious plan of hundreds of billions of money needed to really accomplish in the next 5 years. So definitely is going to continue. And for us, it has been a dream come true, really, in terms of having this plan outlined, as we have been working closely with the Rwanda Biomedical Center, the Ministry of Health, in developing the plan, and also using the experience that we had in Butaro Cancer Center. That was the first cancer center of excellence per se that we started in 2012. So we had a lot of data in terms of type of cancers, treatments, protocols, and so forth that have been informing that plan for the past 8-9 years. So definitely the work will continue. It's a high priority for the government. Non-communicable diseases, like many other countries across the globe, we're experiencing what we call now a double burden of disease. So where non-communicable diseases, including cancers, are becoming the main drivers of mortality and morbidity in our country. So it's a high priority, obviously, for the country. And the setting that have already been there with our partnership and the investment of the government of Rwanda. Only 2-3 years ago, the government opened the first radiotherapy center, and more are still coming. So this is going to continue through great partnership, great vision, and a commitment for investment from the government.